So I think like we didn't press start, so we can, instead we can just like you can stop and start it then, and we'll just start with the whistle.
Oh, they don't really whistle after the first 5 minutes, so nobody's really taking about 5 minutes. So just let me know when you're ready. Okay.
Well,
You have a max of 5 minutes.
yeah, I don't think you need to run that for my preparation.
We got the card working, so it's okay.
Yay!
Or you could just go back, just with the address. That's what you need, right?
Yeah. Position number, you don't need position. Just a signature. Oh, BPM. Yeah, that'd be fine. Oh, is it 1 second? Yeah. Yeah, that's fine.
Okay, I think I'm ready to go. Are you recording?
Yep, it's done.
It's already on?
Yeah.
Oh, great. It has me chewing my lip and everything.
Oh.
All right. Hi. So I'm Hannah Sheik, and I'm the pharmacist on duty right now. Are you taking over, covering me?
Yeah.
Great. Okay, so I have one patient that I would just like to communicate a little bit about to you, just to make sure that we're on the same page and that you can ensure continuous care to the patient. Oh. So this patient is Larry Davis. He came in last week, and he brought in a prescription for Champix. He's a 40-year-old male, and he's been smoking for about 15 years now. And he was curious whether Champix or Zyban would be a better choice for him as a prescription for smoking cessation.
Okay.
He has tried nicotine replacement therapy in the past and smoking cessation without any aids at all, and neither of those were effective, and so he wanted to use a prescription aid.
Okay.
So those were his two choices.
Okay.
He has no past medical, known drug allergies or medical conditions that he's aware of. That means that he doesn't have any history of depression or of seizures.
Okay.
And he did take the nicotine replacement therapy about 6 months ago, and he noticed that he had some really bad headaches and heartburn with them. And although they weren't successful with helping him quit smoking, he was able to cut down on the number of cigarettes that he is smoking. So he's now down to half a pack a day.
Oh, okay.
His father smoked and actually died of heart disease, and so he is a bit concerned about that. As well, he has noticed, his doctor has told him that his blood pressure is rising, and so that is a concern for him and possibly his main motivation for trying a prescription aid at this point in time.
Okay.
So when I went through we sat down and we went through the shared decision-making aid together, and just kind of highlighted the differences and similarities between the two prescriptions, and I showed him that both of them would have approximately the same efficacy, like both of them are approximately the same at helping people quit smoking, but there were some differences, and that would, with the Champix having the history of like the side effects of suicidal thoughts and vivid dreams and nausea, and the Zyban having seizures and more insomnia.
Okay.
So he said he wasn't so concerned with the major ones, like the black box warnings, but he would prefer to tolerate the vivid dreams over the insomnia, so that he was leaning a little bit towards Champix, and he also was a little bit uncomfortable with taking an antidepressant, so it also leaned him towards Champix. That being said, he was also very concerned about not experiencing headaches or heartburn on these medications because those were the reasons why he couldn't do the nicotine replacement therapy earlier. So I looked it up on ECPS and Lexicomp, and Champix has a lower incidence of that. So,
Okay.
so then I got a note from the technician saying that he phoned on January 30th and he wants the prescription filled, and he's going to come in on the weekend to come pick it up.
Okay.
And so what I would like to do is have the starter pack filled, the 14-day starter pack filled, and we'll give it to him and set a quit date with him and ensure that he starts the medication 1 week before his quit date.
Okay.
And then once he's used up that starter pack, then he can return to the pharmacy, and we'll assess him then for any changes in mood and nausea and vivid dreams.
Okay.
And then going from there, he can take the refills, 2 packs, 1 pack, whatever he would really prefer, and then we'll follow up at each refill.
Okay.
And then also and then around 1 month or so, we'll kind of give him a phone call and see if he's noticed any effect, and if not, that's okay. We'll just continue on because it is a 12-week therapy.
Okay.
So, and then he'll continue to the 12-week therapy. Do you have any questions?
No, I think that's okay.
So,
Is he concerned about the cost or coverage at all?
no, he's not concerned.
No? Okay.
Not concerned about the drug cost at all. No. So the main thing that I want is just that you set a quit date with him and record that as well, so I can follow up with that.
Okay.
And then give him the starter pack and just kind of go through how to use that and what he can expect. And if he notices any side effects, that he should phone the pharmacy back, and the onus will be on him until his refill date.
Okay, that makes sense.
Okay. Sounds great. All right. That's all I wanted to communicate on him. Thank you.
Okay, thanks.